My name is Kathy Nelson. I am the head of Cancer Network for the CCG, but my role also incorporates ICS working as well. So I work with partners across the ICS in terms of the hospital teams, obviously our commissioning and transformation colleagues, as well as social care and some of our cancer charity partners. So we kind of call ourselves a one team, a one cancer team for BLMK, but we're all employed by different people.
What does a day in the life look like for you, Kathy?
So in terms of day in the life, typically it's filled with meetings and kind of managing email traffic, as you would expect. But as I said, we kind of work across a number of organisations. So much of my work is involved in terms of transformation, and you will all have seen in the news around the impact that COVID has had on cancer and the services that we provide for patients. And so most of what I do is around the recovery and restoration of cancer services. And for those of you who don't know what that might involve, we had a number of objectives last year to make sure that people, when they're referred for signs and symptoms of cancer, that they were able to see their GPs, they were able to have a face-to-face conversation, they were able to be referred into the hospital in a timely way and have their diagnostics and their cancer diagnosis confirmed. And more importantly, that treatment was in a timely way. So we had to kind of work together across BLMK and the hospitals to make sure that people's treatments weren't delayed. And so a lot of my work now is still around that, although we've managed that part of the COVID impact, it's still a lot around redesign of cancer services to make improvements based on what we learnt last year, really.
How will integration transform cancer care services across the system?
For me, integration and cancer kind of went hand in hand because if you're not aware, cancer services are commissioned at different levels. So GPs commission some elements of cancer care, public health. We commission it from the hospitals, specialist commissioning are involved. And we also partner with charities like Macmillan to provide services. So from that perspective, there's integration in terms of what we see as cancer care is delivered and commissioned by a number of people. And we all work together to make sure that's seamless. But we're kind of pushing the boundaries a little bit in our programme in terms of, well, actually, if we're working together as partners, how can we actually do that work together? So some of the examples of that is using our transformation funding that we get to improve patient outcomes. One of the pilots that we're doing is looking at women with breast cancer who are going through chemotherapy treatment. And sometimes you can actually have alternative treatments if chemotherapy wouldn't add benefit. You wouldn't have then all those side effects that come along with chemotherapy. So we're always trying to look at improving outcomes. And one of the things that we introduced was a new test for women with breast cancer that actually determines your risk around whether chemotherapy would add benefit or not. And so that means there's a number of women now who will have the test and dependent on the outcome of that, won't necessarily have those nasty side effects from chemotherapy. They can maybe have something else, and we're improving their life, their kind of daily living. So that to me is something special, that the work that we do together as teams actually helps people on the ground in terms of their quality of life. That's so important. Many of us have been touched by cancer. We know people, we ourselves may have had to go through cancer treatment, and anyone who has been affected by cancer will know the impact it can have on the smallest things in life. So for me and the team, we are absolutely keen on making sure in all that we do, it's about improving those patient outcomes at the end of the day. So for me, that's the bit around integrated working that we're keen on developing.
If you could give one piece of advice to someone interested in working for the NHS, what would it be?
There's something for me around finding your niche, and whatever that thing is, how small, how big, it doesn't matter. It's important to kind of, when you find your niche, nurture it, and it will always help you. That thing for me has always been about patient voice. So I started my career doing complaints, managing complaints of people, because that was, for me, I wanted to hear those stories so that I could help influence change and redesign services, knowing that actually the patient's voice was at the centre of it. And that would be my advice to anyone starting out, is that you can always take something you're passionate about and make it work in the NHS, because there are so many different careers in the NHS to choose from, and it's a great place to work.